and former chief medical advisor to President Trump. That's Dr. Ronny Jackson. And Dr. Jackson is currently running for Congress as a Republican in Texas's 13th district. Also joining us this afternoon, Dr. Paul, an internist, gastroenterologist, and residency program director in New York City. Dr. Jackson, you've worked in the White House. I assume these people are close together. What do you think when you hear this story?
Well, I'll tell you guys, I recently was at the White House a couple of weeks ago. I know exactly what's going on there with regards to the testing. They're being very aggressive about testing everyone that has any interaction in the West Wing at all. It sounds like they're going to ramp that up now and include folks that work over in the Eisenhower Executive Office Building and maybe the new Executive Office Building, which will be a bigger pool of people that have some contact with folks that do ultimately have contact with the President and the Vice President. But they're testing people aggressively there. Everyone's on a schedule. They're getting tested every few days. They're going to naturally find a few people that have this. They're going to go the extra mile now to make sure that the President and the Vice President are safe. They'll keep a close eye on them. They've already been doing that, but this will ramp that up even more. And the first indication that they're having any symptoms or they might be getting sick, they'll know about it and they'll react quickly. But I just think that they're going to extremes right now to make sure that no one that has this is in contact with them. And I think that's the best they can do.
But Dr. Jackson, isn't that strange? Just 2 days, 2 cases back to back. Does that raise any questions for you?
I don't think so. I think that, there were probably people there that had it before they even started doing the testing. I think that all of us are surrounded by a few people that we don't know about that may have it and not even have symptoms and know about it. So I think that they're trying to do the right thing here. They're trying to get the country opened up again. They're trying to walk that line between, being aggressive about, social distancing and contact tracing and keeping this disease under wraps, but also, present a unified front that they're not creating undue fear. Mm-hmm. And, have the President and the Vice President on national TV wearing a mask all the time, that really does create a lot of fear in our country. And I think
some say, Dr. Jackson, that it would actually be modeling something that they're encouraging other people to do. And I'll just get to Dr. Paul, since we've left him out of the conversation so far. And I understand the point you're making, Dr. Jackson. You don't want to be fearful. You want to have a brave and go forward. But Dr. Paul, now when you have 2 people in the executive branch testing positive, maybe a different message needs to be sent out there?
I actually would have preferred that the administration would have worn masks and modeled the appropriate behavior of both wearing a mask, hand hygiene, and social distancing. I think, with all due respect to my colleague, that with 2 people testing positive, my concern, though, is when he was at Mayo Clinic and he wasn't wearing a mask, that modeled the wrong behavior and may have incited those who are currently protesting to sort of galvanize their position.
Dr. Paul, can you talk to us about the incubation period of coronavirus? And even if someone tests negative for coronavirus today, how far into the future do you think they need to undergo daily testing? And how soon before we know if really the Vice President and President are going to be okay?
So, they are our leaders of the country currently, and the daily testing, I think, is primarily to sort of get them ahead of the curve. The incubation period ranges 7 to 10 days. That's part of the reason why we've been telling people that they should isolate if they've been exposed for at least 2 weeks to monitor for symptoms to occur. The idea of what they should be doing, I think they're being aggressive, and I think they're taking the right approach to make sure that the leaders of this great country are in good health.
All right. Dr. Jackson, yes, I did notice that you put the Lone Star behind you. I'm very impressed. You got that Texas thing going for you. I did want to ask you about what's getting your attention as far as treatment is concerned. There appear to be some reports of brand names of an arthritis medication working to some extent, and I don't want to mispronounce these, but I'll give it a shot anyway. Actemra and Roactemra. Have you seen progress with those, sir?
Yeah, I think they're one of the drugs that are being looked at now. I think, right now Remdesivir has been shown to have the biggest impact, but this Actemra has been looked at. It's an anti-inflammatory drug, and we know already that a lot of the issues that are from the people that end up in critical care, especially people that end up on ventilators, is the inflammatory reaction in the body and the damage it does to the tissues in the lungs. So this is an anti-inflammatory drug. It kind of makes sense that if you could give this to somebody who may be headed down that path of inflammatory damage to their lungs, that you could impact that. And so I think that's exactly what's going on right now. I think they're looking at that. There was some early testing that was done in France. It hasn't been vetted or peer reviewed just yet, but some of the early results have looked pretty promising. suggesting that this may be a drug that we use down the road, especially for patients that are in the ICU and are having respiratory difficulty.
Dr. Sampal, what do you find most encouraging or to have the most promise right now?
I've actually had a few patients I've actually given tocilizumab, which is the generic name for the medication we're discussing. I think what's promising about this medication is that cytokine storm, where the interleukins that are essentially trying to fight the virus, but inadvertently also attack our own tissues and cause that respiratory distress. This might actually be able to sort of mitigate that response that usually occurs around day 6, 7 of infection and help steer patients away from that overwhelming inflammatory response. So I think this is going to be a part of the armamentarium of what we can do in terms of battling those patients who are heading down that path. But again, as Dr. Jackson said, we still hasn't peer-reviewed the data from France. It's still pretty early. But again, at this point, all hope is good hope.
Dr. Sampal, will there be a vaccine? Because there's not a vaccine for AIDS, even though there's some treatments. There's not a vaccine for a lot of things, but we learn how to treat it. Do you actually have high hopes there will be a vaccine, or do you think this will be a matter of treating it?
I very much hope that there will be a vaccine, and I'm hoping that it does come about. If the treatment gets so far advanced that we can actually quell the virus, then maybe herd immunity will help as well. But very frankly speaking, my fingers are crossed, and I'm hoping that just like we've done in the past with Jonas Salk and all the great pioneers of medicine, that this will be one of the greatest shining achievements of the human race.
Dr. Sampal and Dr. Jackson, thank you so much for your time and for sharing your wisdom with us today. We always appreciate it. Right now, we want to take you to a meeting. President Trump is apparently with House Republicans, and we want to go ahead and take a look.